Hi,
Okay.
everyone. Welcome to this breakout session. We are going to go through a couple of housekeeping things before we get started. First, like always, you can submit questions into the Q&A box on the control panel right down there. Closed captions are available for this session and materials will be emailed to you later today. If you're having any technical difficulties, there's an email address right there that you can email npaf@npaf.org, and we will walk you through it. You can always join our conversation on social media using #HealthNeedsNav, and that will be it. We'll get started. Speaking with us today here are Rebekah Ango and it looks like we also have Kate Gallagher here. So, and so we will get started. Thank you.
Hey, thanks, Katie. So without knowing it, or maybe you all know it, you are in a very special session. This is the only one that is interactive. So you have the ability to be on, all the attendees have the ability to be on camera as well as contribute via unmuting your mic. This is a real live Zoom meeting, not a webinar. So no pressure to turn on cameras, but we'd love to see your face. And hopefully a lot of this meeting or this session will be less of me talking and more of you talking. So I am going to just share a couple slides to get us started. And do a couple pieces of housekeeping as well. So just making sure you can see my slides. I see a couple people nodding, I think. So that is great. The technology is working. And later on, if you want to come off camera when we kind of start the discussion, we'd love that. If you want to unmute yourself, we'd love that. Later on, we're going to be setting up a whiteboard that you can actually type into and write on, or you can put comments in the chat. So that is going to be how we're going to talk and interact today. And really, this session is all about your experience during COVID-19. I'm going to do just some really brief remarks about patient-centered outcomes, kind of what's been happening in that space related to the pandemic, and then we're going to jump right into a conversation. Those of you that were at my session yesterday, this may be a little bit of a review, but essentially patient-centered outcomes research is really focused on outcomes that are most important to patients. Those can be medical, but they don't have to be. A lot of times they're focused on quality of life and integrating the patient voice and perspective of patients into the outcomes that matters most related to healthcare, decision-making, access, cost, risk and benefit, things like that. And so the patient-centered outcomes research really is just research focused on those outcomes, those patient-centered outcomes and what matters most to patients. The idea is that researchers really need to and should be focusing on what matters most to patients. And the only way to do that is to talk to patients, listen to patients. And we set up a session today to do just that. So we're going to dive right in. There is a lot of research on the COVID-19 pandemic. So not a diagnosis, although we can talk about that as well. But just the pandemic itself, right? We are all collectively experiencing a new way of living, a new way of working, a new way of accessing healthcare, and a lot of unique challenges just because COVID-19 is now a part of our life. There's been research that's going on about the impact of the pandemic on mental health, the elderly, how cancer patients or patients with cancer are accessing care. There's been research on suicide rates, the impact on ED visits, looking at different populations and the negative impact COVID-19 has had on those populations or communities. There's research looking at drug overdoses, changes in cardiology services, the economic and financial hardships, and even the impact that COVID-19 is having on non-COVID disease. So the outbreaks, different outcomes on non-COVID disease. So there is a lot of research going on around the impact of COVID-19 and specifically, just the pandemic itself, not even a diagnosis. And what we thought we could do today, we're not going to be able to boil the ocean, right? We can't do everything, but I thought it would be a really great opportunity for us as a group to talk a little bit with our patients and caregivers, with our patient advocates, with our providers and researchers and great partners that are a part of this conference with us, and see what's being missed. A lot of the research that I did when I came up with that list was looking at what researchers are doing, but very little of it was patient-informed, patient-driven. It was really things that researchers are interested in or things that they've been noticing bubbling up in care, but I didn't find any work around patients informing these research studies. So we're going to try to do a little bit of that and see what this group comes up with. So we all on this call have experienced living in and with a pandemic, regardless of if you have had a diagnosis or if your household has had one. I'm sure there are some people on the call that may still be experiencing symptoms of COVID. But I'd love to take the conversation in whatever direction this group wants to. But if you could sit down with a health researcher, what do they need to know about your experience as a patient and caregiver during the pandemic? And we're going to start there. I'm going to stop sharing my screen so we can do a little whiteboarding and so we can see each other if your cameras are on. But I wonder if somebody, and it's the first time we've asked you to jump in, but if there's somebody that wants to kick us off on what they would like researchers to know about their experience.
Yes, I would like to start off by saying that I would want them to debunk myths. I want them to have sessions where they just debunk the myths that are out there, like, yeah, don't eat, don't drink bleach or don't inject it, because that's important. If I know there are groups on YouTube or Facebook that have come together to debunk these myths. But if you hear it from Dr. Anthony Fauci or you hear it from someone, from CDC or FDA, and they're an expert, it does carry more weight. People do listen, and that will be a beginning, I think. I don't know why I'm logged on twice. I'm logged on twice for some reason.
That's okay. So one may be your phone and one may be your video.
Okay.
Rebekah, this is Tony K. Manskow. I don't have my camera on because I'm recovering from surgery, so I just want to kind of listen, but also I just want to share what my family's experience has been during this pandemic. I was a primary healthcare decision maker for my mom and my developmentally disabled brother. And all three of us had the same hematologist that we saw for a precancerous condition. And then my mom had a blood cancer. And during the pandemic, the doctor retired and we were able to get connected with another physician in that same department. But what the experience is that my mom was residing in an assisted living facility. And we went from seeing her 2 to 3 times a week to not seeing her for months. And during that time, she had a severe reaction to the cancer medication that she was on. And the staff at the assisted living, they were overworked. They just didn't have time, and they did not alert anyone to know, so that we knew that she was having this severe skin reaction. And it went for about 7 months before I saw her. And I immediately had her go to the emergency room because of what I was seeing. But what ended up happening is my mom ended up making a decision that she stopped her cancer treatment. And that was really difficult. But the physician that we were seeing, it just seemed like he was rushed. He did not have time to stop and listen to what we were trying to say. I think doctors were very overworked, and they still are. But what ended up happening before my mom stopped her treatment is I had a conversation with the physician on how she did not respond well to a medication, asked him not to give it to her. But when she went to an infusion center, maybe a few weeks after that conversation, he ended up giving her a dose of that medication, and she never rebounded. She just couldn't bounce back. So basically what my family's experience has been is that people that were in assisted living, you didn't see them for months. You didn't really know how they were doing. The physician that was trying to coordinate care for my family, all three of us, he just didn't have time to listen to our concerns. And I believe that my mom went downhill during this time. And so during all of this, watching my mom struggle as she did, I needed to have some surgery. And as her caregiver, the one that was needing to make all the decisions on her behalf, I postponed my surgery up until just this past week. And so I put off my own care just to make sure that I could advocate as much as possible for my mom and my brother. And I think that my mom's life ended early because the physician just was not listening to us. So that's my family's experience as, for being a patient and a caregiver. And COVID just really threw us for a loop. And I hope no one ever has to experience something like that. So I appreciate the opportunity to share that.
Yeah, I really appreciate you sharing it with us. And I also, same as Sarita, we are so sorry for the loss of your mom. And I think it really highlights kind of that ripple effect of, everything we hear and we think about it in a silo, right? Physician burnout, not being able to see our loved ones, which changes how you can be a caregiver, delays in care. None of that happens in a silo or in a vacuum. I think that's an incredibly moving story. And I think there's a lot that we can unpack just from your one experience or about what researchers need to be looking at, honestly, in the impact of the pandemic. Thank you for sharing.
I wanted to share more stories about the pandemic. My mom had a lung transplant because of idiopathic pulmonary fibrosis in December 2020. And her pulmonary therapist had COVID and she has damage to her lungs. So she has trouble breathing and she has all the effects of having, she has long-term COVID. And so, she's still working, but she's very tired. So, and that was probably how she got it, probably several months after the pandemic actually started. And the other thing was, as far as debunking myths, is recently in our area, hospital workers, and the Geisinger is one of the bigger hospitals, and their employees were out on the street because they were protesting having to get vaccinated. So these are medically qualified people who have gone to school and supposed to have the up-to-date information on vaccination. So they would get get them first. So there is definitely a gap even with the medical professional. It was very sad to see, but true. And we're going back and forth about, you know, fighting over, you know, they want to vaccinate, they want to have everybody show proof of vaccination. People who have religious restrictions to getting vaccination, they want to bypass those people too in Pennsylvania. But the knowledge gap is so much, and I hear from my friend that people are, you know, downloading or copying vaccination cards and filling them in because, as one of my friends says, I'm gonna get it if I'm gonna get it, even though I'm vaccinated. So how does it even make sense to get one? And where do I get the money from this? And I'm pretty sure they have made the vaccination available free for, you know, it's covered by insurance, so you can get it. So it's free. So, but I don't know why he doesn't know that, but he doesn't know that, but he knows about ivermectin and he knows about all the conspiracy theories. He knows about Bill Gates putting chips in us. So I'm like, how do you not know? You can just go to CVS and go get it. There is no cost to you. But these things, I mean, this is a important gap that needs to be filled. All right, I'm going to be quiet for a little bit.
No, absolutely. I mean, I think, you know, this goes back to what we were talking about some of the earlier sessions about the importance of disseminating research results and research to audiences beyond just a scientific one. So I think it's very, very valid comments.
Can I piggyback on those last two? I think what Dr. Barish was just talking about really gets to that thing of who's infringing on whose rights. Because I just had a similar experience with my optometrist who casually let it be known once I was in the exam room that she had COVID and was unvaccinated. And, you know, and I'm on an ethics committee for a large hospital system here, and the vaccine mandate is a very real topic right now. And it gets to this thing about, you know, who has a right to know? You know, if I'm in the hospital, do I have a right to know who's vaccinated, who's touching me, and who's not vaccinated? You know, I think that's a topic because everybody just wants to talk about the mandate and people's rights, but nobody wants to talk about the patients who are vulnerable, and have faith in these people who, you know, you think they believe in science, you think they believe in also the greater good and doing the right thing. And then, you know, I'll never return to that practice again. And it's one that I've relied on for a long, long time. So that's one thing. And then getting back to what Tony said, I think a lot for what I've observed with this pandemic is how it really has necessitated advanced care planning. And I don't know how, you know, I'm trying to urge the people around me to make, you know, to really give that a lot of thought, because if you didn't have a patient advocate, a named advocate before, you really need one now. Because at any given moment, someone you love or yourself are going to end up in the hospital and everything's going to change and people aren't going to be allowed near you, or your parents are going to be in an assisted living facility and you're not going to have access. And people really need to have, you know, and people are getting sick who we didn't think were going to get sick. People are going on ventilators that we never would have thought were going to go on ventilators. And they're being faced with really difficult choices that they have not thought about, how they want to be treated, how they want the rest of their lives to go. And I really think it's this pandemic has really brought that to the surface, that we all need to spend time thinking about what's important to us, especially if we can't speak for ourselves and we're faced with, you know, huge life-changing medical treatments.
I just want to follow up on what you were saying on who has the right to know. I'm guardian for my brother who lives in a residential group home. He ended up getting COVID, but they moved in a roommate during all of this, and he had lived in the house by himself with 24-hour staffing. And we do not have the right to know if his roommate is vaccinated or not. The staff, we have no idea. The people that are doing direct cares with him, who's vaccinated or not. And there's been quite a few employees of this group home provider that have tested positive for COVID. So I think at some point it's, it's scary because people can possibly get COVID again. And who is it that you're in a house with for around the clock or 8-hour shifts, and not knowing what their vaccine status has been extremely, it created a lot of fear for our family.
And I think it's that right to know. I think this is really foggy. Why don't we have a right to know? Why does a restaurant in New York City have a right to know, but you don't have a right to know? I think this is a really a topic that really needs to be addressed, because I think people are just throwing out things like HIPAA and rights, and it's like, oh, come on, I have to show my vaccination card in order, to do a lot of things right now. And in some states, you can't go to a concert unless you show it. But you put patients in, cardiac units with, possibility of being treated by a nurse, touched by a nurse that's not vaccinated. I think our priorities are really off kilter.
So we're getting a little bit in the chat, and I think there's a couple things. I'm going to just mention Kate's chat because I think it's related. And Dr. Batish, and I know Sarita, we've worked on projects before, so I've been told to call her that. Then we'll get to your numbers, because I think that's interesting too. As I hear you guys talk about this patient's right to know, and I think you raise a lot of valid points. Kate mentioned that vaccination status doesn't necessarily mean that people can't spread COVID. So even if you're vaccinated, you can still spread the variant. Is that, how does that play into those feelings of kind of needing to know? Is the vaccination, I guess, where my brain goes, is the vaccination more to protect yourself, or is it to protect others? And I'm not sure if we know. How are you guys feeling about that?
So Rebekah, I'll jump in just really, really quick, just because I recently looked at a lot of, the data and stuff behind that. I mean, yes, vaccination is self-serving because it protects you from severe disease and hospitalization, but vaccination within the community setting also does serve the greater good, because you become an entity that is less able to transmit. It's not impossible to transmit. It's not impossible to have a breakthrough infection, and we know people are having breakthrough infections. It is low, but I think no matter what, because this is an easily and readily transmissible disease, like, everybody needs to do everything in their power to be the most responsible individual. So either that's keep your distance, mask up, don't do things indoors, choose to limit where you go, how you go, with whom you go. I mean, I do think it does involve asking those very difficult questions of, is somebody vaccinated? But I don't think ultimately you can just pin it all on that. I mean, I think that there's responsibility in multiple spheres when it comes to trying to abate transmission.
If I can jump in here with my personal story right now, my brother and his family are currently quarantining because their son's daycare, he's 2, he was exposed directly through one of the daycare providers, because even though there's a mandate here in New Jersey, they can opt out and just do testing 1 day a week. And one of the unvaccinated daycare workers had COVID, was tested negative, and then at some point during the other 4 days of the week, came up positive. And that's to me one of those things that goes back to what Julie Wallace over there in Michigan was saying, where I really think when it comes to vaccinations and asking about everyone have a right to know and a right to ask. And two, and I just got into a conversation the other night with Arthur Kaplan, who's been on some of our events, and he is a medical ethicist over at Columbia, that vaccination is actually a moral and ethical priority, really, for anyone who can be vaccinated. So that's my 2 cents in there, but it's hard and it can be really demoralizing nowadays.
Well, Katie, and I love that you brought up the idea, and Julie, you actually, everybody that is commented on this really kind of is getting me there. And maybe I'm just the slow one that my brain finally got there, but it's central to your decision making, right? Like you need to be fully informed so you can make decisions about where you're going to leave your child, or where you're going to receive care, or who you're going to receive care from. So yeah, such an interesting topic. We recorded. Oh, go ahead, Julie.
I just wanted to say to Caitlin too, it's not that I care if people are vaccinated or unvaccinated. Okay, I lied. I do, because I think it symbolizes an intent, an ethical intent. But it's more about, why did my optometrist not think about my feelings? I think it would have been fine if she'd said, hey, Julie, I just want you to know, I've had COVID and I'm not vaccinated for my own personal reasons. Are you comfortable to proceed? You know, that's where I am. Give me the right to make a decision. That's all.
So we have a few minutes, and I do want to make sure I get over to Sarita's comment. Kate, thanks for joining us. Kate's leaving early, but I'm going to be here for the long haul. Sarita, numbers. I'm a public health person. I like numbers. Jump in with your question. And hello to Mo. I just saw your face.
Well, I think the white handkerchiefs or white flags that they put in, 700,000, I forget the last 3 digits, that did make an impact on people, because my physical therapist he's a history buff, he started counting off, let's see, we lost 400,000 men in, probably women too, in World War II. That was the most we've ever lost. And in the Vietnam War, we lost about 57,000, 56 something, so I'm rounding up to 57,000. We have lost so many people now. And why are we not more alarmed? Why are we not lining up to, and they have said that, do a patriotic duty, get vaccinated too. Why aren't we like, vaccinate me because I don't want to, we all feel bad. So, and he said we surpassed the Spanish flu, but he wasn't sure about the numbers, but it was 7 o'clock in the morning, that's okay, but he knew all the other ones. So we lost a lot of people to COVID. And I think far as getting variants, I think we can have as many variants as there are people. And people's immune systems are different. And we get the flu shot every year. And every year there's a new variation, and we can still get the flu, even though we get the flu shot. And the other thing was, just today I was talking to someone, and her child had started school and he's in quarantine and needs to get a COVID test again, because people are allowed to go back to school, and without mandating that you show that it's an actual vaccination card. Oh, and also Tamakwa, which is about 16 miles from here, they were going to go back to school without any masks or any precaution mandate, but the Pennsylvania state, they're fighting it out actually. They're going to do half and half. So I think the more education there is, and I think definitely putting those white flags and the numbers did make a difference. It did make people think. But I also think it's probably the same people who would have thought about it.
Yeah. So we only have a couple minutes. I'm going to go over to Mo in 1 second. And then the last minute, I just want to share with you guys next steps and how you can continue to be involved and how we're going to try to get some of these priorities into the hands and connected with researchers. Sarita, I love that you talked about that big number. I actually heard a number that really hit me yesterday, and I did the math because I didn't believe this number. So I actually did all the math. The math works. 1 out of every 500 Americans have died from COVID. So if, you know, that's, I don't know, to me, that hit me harder than just the 700,000. I can't believe, you know, if you have 1,000 Facebook friends, you know, 2 of them have died from COVID, right? Like that's an interesting statistic. So the numbers, I think, can be shared in different ways to see how they're most impactful. Mo, I'm going to turn it over to you. Thanks for sharing with us and being here today.
Hello, everybody. I'll be really quick. I heard a number today that was alarming to me, which is the Delta variant is affecting rural Americans twice, 2 to 1. And one of the reasons for that, I think a lot of people like to dismiss that as political leanings, and some of that's true. But like Julie was talking about right to know, and Tony was talking about, here's the deal. There's one grocery store here in my county. So not only do I not know who's vaccinated at the doctor, but we all go to that same grocery store. So you're going to be interacting with lots of people who are unvaccinated for whatever reason. And I'm certainly not going to walk up to anyone in the grocery store and ask them about their vaccination status. But, you know, there's nowhere else to go. We all, rural Americans, we gather at the same gas station, the same grocery store. And I live in the last county in West Virginia without a mask mandate for any of the schools. School's been open 5 weeks. It's been closed 6 times. So I'm a homeschool mom now. I never wanted to be a homeschool mom. I'm not good at it. But yeah, we have a problem in rural America, and a lot of it is disinformation. But the other thing that I think people discount is not everybody's a hillbilly who's uninformed. You just have no choice but to interact with your community in some way. And we don't have big box stores where you can pre-order, you know, your groceries and they'll put them in your car. You have no choice but to interact with these people. And I mean, it's a little adversarial to expect everyone to wear a pin that says whether or not they're vaccinated. So that's a big problem for people that live in areas like I do.
Well, I appreciate everybody sharing. You know, Mo, I think you make some really good points about rural communities, and it's honestly a conversation I have yet to hear around patients. So you guys brought something up, at least that's new to me in my space, and I'm sure to a lot of other researchers and research groups as well. So I don't know if you guys knew this, so maybe with or without knowing it, you guys participated in kind of the first learning community activity around COVID, and thank you, this has been amazing. What we're going to do is formalize the things we heard into a list of research topics or research priorities, try to kind of organize everything that we've talked about today. And we are recruiting and putting together a COVID learning community that we are planning to prioritize and publish this list of patient-centered questions, and then really connect with researchers to address these questions and outcomes in their work. So not only do we want to say what's important to patients, but we want to find ways to get these actually in the hands of patient-centered researchers in partnership with patients and caregivers. So I will likely dig up the emails of every one of you and reach out individually and ask you to be a part of this group. But this is also my invitation to you. Please, if you have some time, the commitment is 1 meeting quarterly and then some online self-paced training just to get you up to speed with the research world, as well as some kind of online feedback. So it's not a heavy commitment to be part of this learning community, but we are putting together right now a group of patients, caregivers, clinicians, and researchers to really come together and shape how, what research is being done around COVID and the pandemic in general, not necessarily just a diagnosis. And I think you all have so much to bring to this work. I would love to see you be part of it if you can make time. I know everybody is so busy, especially the homeschool mamas. I was one of those for 18 months. So I feel your pain. So that's the end of our session. I'm going to make sure I get you to the next session on time. I believe we have a break after this, but please check your official agenda because my memory is not the greatest. But thanks so much for being part of this today, and we will be in touch and follow up.